Yes. So this is radiological anatomy, and you can see here the view is the of PNS. The most important thing is you're going to put the left and right marker. Okay. Next, you have to check that in this particular area there should not be any metallic artifact or metal objects. Try to remove them. Okay. Next thing, coming to the sinuses, we have four paired. So first from top we have two pair of frontal sinus, this two, and this is the orbit area. Okay, so above the orbit we have what? We have the frontal sinus. Below the orbit, what you get? See, triangular shape. Okay, so these are my maxillary sinus. We have two, right and left maxillary sinus. In between the orbit, what you are getting? We are getting the ethmoid sinus, right and left. And here you are going to get, in water's view, open mouth, you can see the sphenoid sinus. Okay, so next thing is, you can see one straight line here. So this imaginary line we call it as MSP, mid-sagittal plane. Okay, and in this area you can see one small, this structure is there, and this is known as crista galli, crista GALLI, crista galli, and it gives the attachment of flexi calibri. Okay, this is a small portion. It generally comes like this. You can see a small structure like this is the crystal valley. Okay, next thing what you can see here is, see this is the odontoid process of C2 spine, where it gets attached with the C1. Okay, and this odontoid process can be seen only in C2, and that is why we have to give the angulation so that it won't come to the area of interest. Okay, next, this all structures, this is the mastoid area and these are the mastoid air cells. We also have a special view where we can see this mastoid air cells. This area is known as the petrous ridge, PETROUS, petrous ridge. This area, this particular area is known as condylar area. So when you're taking the water's view, make sure that this condylar areas are equidistant, meet at same point to each other. Okay, this one, so this is known as the angle of mandible, and this is my mentum area. So when our acanthion, glavella and mentum meets, they form a line known as GAL, glavulo acanthion line. Okay, so that's all you can see in the PNS radiograph. Even you can see this is the zygomatic process. This is the zygomatic process. You can see zygomatic arch. You can see here. Okay, so that all is not our consideration. We have to mainly confirm the sinus areas and we have to bring it in the image. And finally, I'll show you one more thing here. So you can see here, this, there is a one cartilaginous structure and this is the septum. So if any patient has any problem, so we say that this is a DNS, deviated nasal septum. Okay, so this is all our open mouth view. You can see here, see this is the mouth, this is the mandible and this is the maxilla. These are wide apart. So see here, these are both are wide apart and this is an open mouth view. Here in this area, so you can see the sphenoid sinus. Okay, this is the maxillary sinus. This is my condylar region area. This is the petrous ridge. Okay, this you can see here, this is the frontal sinus. Only I can see the left side, not in the right side. That means the patient has rudimentary frontal sinus and this is missing in the right hand side. Orbit, inferior ring of the orbit. Okay, then this is my maxillary sinus, this is ethmoid sinus, slightly left sided DNS. This is what you can see, this is not straight, so patient has slightly left sided DNS. This is okay, but there is one of the mistake here is that the image is not cropped. Okay, and you can see the odontoid process here also. See, this is the odontoid process, this one. Okay, this is my C2 and this is my C1 and C2. And the most important mistake in this radiographs is that, see this one, nose pin of patient. So this is a metal artifact showing here. So try to remove this when you are doing for the patient. Okay. So here you can see this is an skull AP and lateral view. I just don't want to show you the skull AP and lateral view. This is not my area of interest, but I'm going to show you here mainly is the sinus area. So this view, we can say this has a similarity with our Gladwell view of PNS, and this is mainly to see the ethmoid sinus. And you can see this is a pediatric x-ray. How you are going to confirm? See, just look here in this area. See the sutures is still yet in the frontalis stage. It is yet to develop, and you can see here the sutures. See this areas, okay. And in so this is my ethmoid sinus, okay. And you can see here the frontal sinus has not yet developed, and it's totally rudimentary here. This is a pediatric x-ray. This is the petrous ridge. This is the maxillary sinus areas, and as it's, you can see here, because this is totally a closed mouth view, both see mandible here and maxilla both are in contact. That means it's a closed mouth. See here we have a same, this is a lateral view, and samely you can get the PNS lateral view here. So see here, this is the frontal sinus. You can see the anterior ring. See this is my, see this is the anterior ring and this is the posterior. So if I have a polyp, now I can say that this is present in the anterior ring. But same thing when I'm putting here, it is not possible for me to understand whether it is in anterior direction or posterior direction. So this is my frontal sinus, this is the ethmoid sinus here, okay. This is the maxillary sinus, and see this is the pituitary area, and this area you will get the sphenoid sinus, okay. So this is how PNS, but you have to crop this area. So like this you are going to do a cropping, and you are going to zoom the image, and you are going to give it, okay. So this is, so see here, this is our Cladwell view, and you can see here the orbit region, but this is not actually Cladwell, this is Towns view. So just to make you understand that, you can see here this is the ethmoid sinus area. This one, this is the ethmoid sinus area, and this straight line is the nasal septum, okay. And so mainly to see the frontal and the ethmoid sinus, this is for the purpose of Cladwell view, and this is an adult X-ray.